Welcome to the No Medical Imaging, where we make medical imaging easy to understand. Most clinical MRI scanners operate at 1.5 or 3 Tesla. But what happens when you more than double that power to 7 Tesla? How can a magnet strong enough to lift an automobile visualize individual neural cell layers inside the human brain without making an incision? Today, we are exploring 7 Tesla Ultra-High-Field MRI. We will explain the fascinating sensory experiences patients encounter in ultra-strong magnets while breaking down dielectric resonance, parallel transmit technology, and chemical shift scaling for our technologist community. For patients with complex neurological conditions like intractable epilepsy, multiple sclerosis, or early Parkinson's disease, standard MRI scans can sometimes appear completely normal. At 7 Tesla, the scanner acts like a super-powered diagnostic microscope. It reveals tiny brain malformations, microbleeds, and early nerve degeneration that are far too subtle to see on conventional hospital scanners, giving neurologists and neurosurgeons exact targets for precision treatment. Patients entering a 7 Tesla MRI often notice unusual physical sensations that are completely harmless. As you move through the magnetic field, you might feel a brief sensation of room-spinning dizziness, notice a faint metallic taste in your mouth, or see tiny flashes of light when moving your eyes. These temporary effects happen because your inner ear fluid and metallic dental fillings interact with the ultra-strong magnetic field while you are moving. For our technologist community, the core physical advantage of 7 Tesla lies in proton polarization and signal-to-noise ratio. According to the Larmor equation, the precessional frequency of hydrogen protons scales directly with field strength, reaching approximately 298 MHz at 7 Tesla compared to 64 MHz at 1.5 Tesla. The net magnetization vector increases supralinearly, roughly following B0 to the 1.65 power, providing immense baseline signal that can be traded for sub-millimeter spatial resolution. Higher field strength introduces significant radiofrequency physics challenges. At 298 MHz, the RF wavelength in biological brain tissue shrinks to approximately 12 centimeters, which is smaller than the average human head. This causes constructive and destructive wave interference, known as the dielectric effect. Without correction, this leads to severe B1 field inhomogeneity, causing central image brightening and dark peripheral signal dropouts. To overcome dielectric wave interference, 7 Tesla systems utilize parallel transmit technology, or PTX. Instead of a single RF body coil, PTX systems utilize multi-channel transmit arrays where each coil element independently controls RF pulse amplitude, phase, and timing. Real-time RF shimming tailors the electromagnetic field to each patient's unique head shape, restoring uniform flip angles and homogeneous image contrast across the whole brain. Magnetic susceptibility effects scale linearly with magnetic field strength, making 7 Tesla the ultimate tool for susceptibility-weighted imaging. Microscopic local magnetic field distortions caused by deoxygenated blood and tissue iron deposits are heavily amplified. This allows breathtaking visualization of cerebral microvessels down to the sub-100 micron scale, as well as distinct cortical laminar ion tracking in neurodegenerative diseases. Protocol design at 7 Tesla demands strict attention to tissue relaxation dynamics and energy deposition. Tissue T1 relaxation times lengthen significantly, requiring longer repetition times TR to prevent saturation, while T2 and T2 star times shorten. Furthermore, because RF power deposition scales with the square of the Larmor frequency, managing specific absorption rate limits requires low refocusing angle fast spin echo trains and specialized adiabatic inversion pulses. In functional neuroimaging, 7 Tesla delivers unmatched spatial and temporal precision. The blood oxygen level dependent BOLD contrast signal increases dramatically, while signal from non-specific draining veins is suppressed relative to capillary microvessels. This enables neuroscientists to perform laminar fMRI, mapping cognitive neural activity across individual cortical depth layers in real time. Ultra-High-Field 7 Tesla MRI pushes the limits of physics and engineering, transforming how we understand and treat brain diseases. Thanks for watching. If you learned something today, make sure to like, comment, and subscribe, and check out our merch store for more cool medical imaging items.